And good afternoon. It is November 25th, 2024, my son's birthday. He was born on November 25th, 2004. So throughout the day, I'll be celebrating my son's birthday. Shot, you're holding the button down too long. This patient has 4 herniated degenerated discs. He had trauma years ago, and his herniations are causing more symptoms. 2, 3, 4, 5, 6, 7. We're going to fix 4 discs. We're going to start with number 6, 7, and then 5, 6, and then we'll move up to 4, 5, and 3, 4. Shot. AP. The hardest disc to get to is 6, 7. That's what we're starting with. It's perfect. We're dead center. Shot. If you have questions, feel free to ask. This patient is from Florida. I can tell you he injured his neck in another country. He was assaulted. I can't tell you anything more than that, but as a result of that assault, he now has 4 herniated discs, and they are pushing on his spinal cord and nerves. Let me also report to you that our last patient, we did 2 discs, cervical, C4-5, C5-6. She's already awake. She's ready to go home. And her weakness in her left arm is not normal, but it's much improved by 50%. So she's able to hold her left arm up. Before surgery, she couldn't even lift it. All right, we're going to do a discogram. It's great news. Shot. It looks like the dye is coming out the front. Shot. Shot. All right. Getting a little bit going out the back, but most of it's coming out the front. We're going to go ahead and get started. Let me have some numb. If you have questions, feel free to ask questions. But this patient has 4 discs that we got to fix in his neck. C3-4, C4-5, C5-6, C6-7. He did not want a fusion. If he had a fusion, he'd have to fuse his whole spine. In his neck, he would lose all the movement, 50% of the movement actually, because 50% happens at C1-2 and occiput C1. So he would lose all the normal movement of the neck where we're fusing, but we're not fusing. He wants the Deuk laser disc repair. 4 millimeter incision. Now his son was under attack. That I can tell you, and he went to save his son. And as a result, the thugs attacked him and his family, and he lived to tell about it, thank God. But when he realized he had disc injuries in his neck as a result of this assault, that he did not want invasive surgery. He did not want a fusion or artificial disc. He wanted the least invasive treatment that is highly successful. He learned about the Deuk laser disc repair and decided this is the surgery he wanted. So he did our free MRI review, which by the way is free. And after that free MRI review, when meeting with me, he decided, I want that laser surgery that Dr. Deuk does at Deuk Spine Institute. Shot, AP. So he came here for his surgery. We just did his MRI review, I think last week or the week before. And he's here now getting his surgery done. If you have questions, feel free to ask. All right, the dilator is dead center in the spine. It looks perfect. We're going to go in and repair the first disc endoscopically with a laser. We've lost maybe 3 drops of blood. Here we go. Any questions? Shot?
No current questions. We do have a comment coming from Thomas on YouTube.
Hi, Thomas.
Saying hello to Jacob and the receptionist at Deuk Spine with the bluest of eyes.
Thank you so much, Thomas. Great to hear from you. All right. Here we go. So while we're doing this, let's show the audience all the different causes of neck pain, because there's 30 of them. I'm Dr. Deuk, CEO and founder of the Deuk Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Deuk plasma rhizotomy is the best treatment in the world available for painful facet joints. Deuk laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. Welcome back. We are trying to get the dilator out, and we got it, because he's got so much scar tissue at the back of his disc there. You guys can see the tube is in the back there. It's perfect. We're as far back as we can go. We're right inside that tear. We're going to clean the tear and work our tube back a little bit to get all the herniations we can. Remember, our surgery and no surgery on the spine makes the spine look normal. We are at 6-7, 2, 3, 4, 5, 6, 7. Everyone agrees? 6, 7. If you have questions, feel free to ask. In the meantime, I hope you enjoyed our video on the 30 different causes of neck pain. The most common cause of neck pain by far, 85% of all neck pain that's chronic comes from the disc. This patient has 4 discs. So it comes from damaged discs that are injured from trauma. This patient has 4 of them. So we're going to fix all 4 today. If you have questions, feel free to ask Henry. In the meantime, I'm going to get my laser to where I want it. I'm going to get my focus done. There we go. And we're ready to get started. I'm sorry? Yeah, it's a lot better. Why is that? Light box? Yeah. You changed the light. Whoa, we just had a flash. You changed the light box?
No light box. You just probably is burning on the tip of the, where you connect the light.
What was that? Were you just catching the light? Huh? See that?
Yeah.
All right. Let's turn the light down a smidgen. So Luis, come on. What exactly are you trying to tell me? Get it out.
So when
It's the box is too dim. The light bulb is too dim.
I believe it's a scope.
The scope.
The scope.
All
Yes.
right. So the fiber optics.
Yeah, yes.
Inside the scope.
Actually outside the scope.
It's not possible.
Wherever you connect the light source, it's burning that area. So it's making a dark in that area.
Really?
Yeah.
All right. Well, you're gonna get that repaired?
Yeah, of course.
Yeah. I've never heard of that. Maybe there's glue there. All right. If you have questions, feel free to ask. Here's our first herniation. You guys see it? We're zapping it away. It's got a lot of gold color, which is calcification. What happens in the human body as your body tries to repair damaged tissue? It calcifies it. It doesn't do that to everything. It does it only when the inflammation has been going on. Your body's been trying to heal it for a long time, like years. You get this calcium. You guys see the calcium in the disc herniation right there?
Yes,
and you see the calcium next to it, which is a bone spur. So the bone spur is coming off the end plate, and the calcium is inside the herniation. That's what this white stuff is, herniated disc. Now, why did this herniation not stain blue with our Deuk spine dye? The answer is simple, because it's collagenized. It's got way too much collagen. All right? Collagenized herniations do not pick up the dye that we use. The dye that we use only binds to degenerated nucleus pulposus. And once your herniation gets past the phase of degenerated, it goes into scarred, and scarred does not bind the blue dye. All right, we're at 6-7. You can see right here all herniation and scar tissue, a lot of scar tissue, bone spur right there. I'm zapping it away. People always ask me, can the Deuk laser disc repair procedure remove bone spur? Well, we just did. You guys see the bone spur is gone right there. Okay, so it does remove bone spur. I'm not going to take all of his bone spurs out because most of his bone spurs are not causing any symptoms. We don't treat things that don't cause symptoms. That's a very important concept people need to understand. A lot of people think, oh, you got a herniation, has to be treated. No, you only treat a herniation that causes symptoms, or a bone spur that causes symptoms, or scar tissue that causes symptoms for that matter, or calcification that causes symptoms. Anything abnormal only needs treatment when it's causing problems for the patient. Most of these do not. All right, any questions?
At this moment, no current questions.
Then let's share with the audience how it is that a herniated disc like this can be so painful for people that have it.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. So herniated discs don't just cause neck pain, they can also cause weakness in your arm, numbness in your arm, and tingling, like pins and needles in your arm. All those are symptoms of pinched nerve, weakness, numbness, tingling. But pinched nerves never cause neck pain. That's something that a lot of people have a hard time understanding, and they're misinformed by other doctors and told that pinched nerves cause neck pain, but they don't. Pinched nerves never cause neck pain. Pinched nerves are not responsible for back pain. What's responsible for neck and back pain is the annular tear with inflammation in the annular tear, as you saw in our video. And the laser that we use is the only way in the world to get rid of that pain. It's the only peer-reviewed and published technique that actually eliminates neck pain and back pain by treating the source, which is the annular tear and inflammation in the annular tear. Now, this patient injured his neck how long ago? 5 years ago. So look at the amount of damage from 5 years ago. This is all scar tissue here from chronic inflammation. And it was pushing right on his spinal cord. And I'm literally removing this at about, remember that laser fiber in front of you is 0.5 millimeter, 0.5 millimeters. So it's very, very small. A millimeter, if you take your fingers and open them just wide enough to see light, that's a millimeter. That fiber you're seeing is 0.5 millimeter. So it's half of that distance. It's very, very small distance, okay? And I'm able to remove herniation at sub 0.5 millimeter amounts, right? You're seeing that. So I don't need to remove the full diameter of the fiber. I'm removing less than the full diameter of the fiber, which makes this procedure the most precise procedure in medicine. As a matter of fact, we can remove just 1/20th of a millimeter. Okay, 1/20th of a millimeter. But this is all scar tissue here. It's unbelievable how much scar tissue he has right up against his spinal cord. All right, any questions?
Yes, we have a few questions. This first one is coming from, forgive me if I'm not pronouncing the name right, Anna Sotra on YouTube. asking, with C5, C6 diffused disc bulge compressing C6 nerve on the right, advised ACDF right away, I opted for conservative treatment, and I've got 95% of my symptoms gone within a month. My MRI also shows disc desiccation and at multiple levels along with the loss of lordosis. I want to know, how concerning is that?
Well, that's a great question. So there's two things you have to be aware of. One is called signs, and the other is called symptoms. Signs are things like weakness, but the patient may not experience weakness. The doctor may find it on exam. In other words, you may think you have normal strength, but you don't. So when a doctor finds something on the exam and the patient's not aware of it necessarily, it's called a sign. It's a physical exam finding. So if you had numbness, weakness, reflex changes, or myelopathic findings such as brisk reflexes, increased tone, then I would be concerned, because that means you have spinal cord or nerve damage. All right? And you should get surgery. But you should never get ACDF. You don't need it. ACDF is an old surgery. It's highly invasive and very dangerous. The complication rate for ACDF is published at 48%, basically 50%. Everybody knows ACDFs have complications, and they're really bad. This surgery you're watching right now is the surgery you want if you have nerve damage or spinal cord damage, okay? This is the surgery. It's done without fusion. It's done without opening your neck up and removing ligaments and discs and bones and things. And it's done without scar tissue from the surgery itself. You got to remember, ACDF and artificial disc and laminectomy, these surgeries, they're horrible. They do so much trauma inside your body, but the doctors will never tell you about it because they don't want to scare you away from their surgery. But I have these surgeries on our YouTube channel at Deuk Spine, and you can go and look at them. And I used to do them exclusively, just fusions and artificial disc. I stopped doing them, okay? Because patients with this surgery here do so much better than ACDF. They recover faster. They have no scar. They have no trouble swallowing. They have no trouble with hoarseness. They have no pain, from the disc afterwards. They may have facet pain. They may have something else, but they don't have pain from the surgery. So they don't take any narcotic painkillers. That's a testament to how safe and non-destructive this laser surgery that we do at Deuk Spine is. Now, you won't find this surgery anywhere else, so you're going to have to come to Deuk Spine. But I would highly recommend you avoid ACDF, total disc replacement, artificial disc, total disc arthroplasty. It's all the same thing. It's an artificial disc. Avoid it. Avoid it like the plague, because so many people are far worse after that surgery. So to answer your question, what you want to do is the free MRI review with Deuk Spine. Henry will put a link there. That's what this patient did, and he came to Deuk Spine to have the surgery done. Okay? It's free. You do it from home. We don't even charge you. You don't have to come to the office. It's convenient. You can have your friends or family members to join you, and you get my undivided attention for 10 minutes, which is about all the time I need to figure out what's wrong and advise you as to what you should do. But that's what I'd recommend. I cannot examine you and see how strong you are over Zoom. So if you're weak and you're losing strength in your arms, or balance problems, or trouble controlling your bladder, then you might have spinal cord compression and myelopathy, damage to the spinal cord. I highly recommend you get that fixed sooner than later. Okay? If your only symptom is pain, then you can wait. If your only finding is pain, you can wait. But if you have neurological deficits, then you should not wait. And by the way, the fact you're doing better is great. However, your symptoms will come back. I guarantee you that. Because the herniation never goes away on its own. Never. I have never seen it. I've looked at 100,000 patients with herniations, and none of them have ever made the herniation go away on their own. Now, there's a lot of tricky stuff that doctors will do, like chiropractors or physiatrists or whatever, to try to trick you into believing that your herniation is going to go away on your own if you just do their conservative treatment. And these guys and gals make a lot of money fooling people, showing these different cuts of your MRI. Basically, they'll take the original MRI will be kind of just off the center to the right of the herniated disc, and then the next one will be a little bit to the side where you don't see the herniation as well. And they say, oh, look, your herniation's gone. So I hear this stuff all the time. They're very tricky. But herniations never go away on their own. This is a bone spur I just lasered away. See that thing? It's gone. That is gone. I mean, it's gone. There's no tricking happening. You know, this is a legitimate, honest to God surgery right here. And you can see the bone spur is gone. All that's left is a little bit of scar tissue, which you got to be careful how aggressive you are with scar tissue because it's stuck right down to his spinal cord. So I don't want to cause a spinal cord injury for him. But you see how accurate the laser is at just peeling this stuff, like literally 1/20th of a millimeter at a time. That's how precise this laser is. Remember, we're at 6-7, and I've gotten rid of everything. There's no more herniation here in the foramen. I'm on his right side at 6-7 right here. It looks really good. A little scar tissue with the ligament there, but the herniations are gone. I'm going to go check the other side. I'm going to go look at his left side. Hold on. There's a piece of herniation right there. Any questions?
Yes, we have a question from Get Strong Naples, Florida on YouTube.
I like it. Get Strong Naples.
Asking, may you explain how the bicep muscle atrophy so quickly? Thank you.
Yeah, sure. Muscles require nerves to send signals to them all the time. That's what normally happens. Your nerves are constantly sending like little messages to your muscles, okay? And when your nerve is getting crushed so bad that it can no longer send those signals, what happens is your muscle doesn't get those signals and it stops contracting, it loses tone, and then it eventually shrivels up and atrophies. Okay, so that's what happens. The only way to get muscle atrophy is if your the nerve connection is lost, basically. And that's what happens when your nerve is pinched so badly. Like, this patient, for example, has that problem. All right? He has atrophy, and the reason is because the nerves are being pinched by these pieces of herniation, which I just removed, by the way. So he's got a little bit left here, and then we're done. But look at the laser. Look how it just performs. There's nothing else in medicine as precise, and you want to be precise when you're operating around the spinal cord and nerve roots. You want to be precise. Henry, any word on what we talked about with the description of the last surgery? Can we get it put into the video so that it's more searchable?
Yes, we can. I am currently transcribing it, trying to see if the link can work, and I'll just keep you posted in a minute.
But so you got to you got to transcribe it for it to get that description, or
yeah. I mean, it has to see the words and then apply it to
But how does it pick up the emotion off the transcription?
How does it pick up the emotion? It's the context of what the sentences was being said.
Oh, so you're saying to get that description we saw before, you have to feed in the transcript.
Exactly. What we're talking about right now, it's going to feed off of the emotion of what we're talking about, and then it will put that into the transcription in like a sentence or two. It summarized.
All right. Let me know once you get it.
Copy.
So we could do this descriptions in real time, almost.
Almost.
Same day at least.
Same day, yes, 100%.
That's amazing. I think that's a great idea. All right, look at that. Just look at all that garbage sitting on the nerve right there. I just removed bone spur right here. You guys can see the diploic bone. I removed scar tissue right here. Man, this is a tough one. I got to be honest. This thing is tough. This is tough right there. Man, this is tough. So, any other questions or comments?
Yes, we have a few more questions. This next one from Timmy Boy on YouTube.
Timmy boy, hi.
Asking, it's very curious as to why other spine surgeons or neurosurgeons don't want the high success rate that Dr. Deuk enjoys with the Deuk laser disc repair. Why do you think no other surgeons want to be trained to do this procedure to enjoy the same or similarly high success rate? Do other surgeons just enjoy doing surgeries that tend to fail over time? Would you think that that's what they would want?
I love Timmy boy. I don't know who you are, but you're awesome. You've obviously been paying attention. So why do other surgeons not do this surgery? They should, right? I've gone to all the big meetings, the neurosurgery meetings, AANS, CNS, Global Spine. I've submitted this surgery for peer review, publication. It's been accepted at all the meetings. I've gone and given the talks. The surgeons have been dumbfounded. You know what I mean? Like they have that look on their face like, holy crap, is this real? You know, honestly, they're like, wow, I've never seen anything like it. And I'll be honest, that's how I felt the first time I saw endoscopic surgery of the spine, because I wasn't trained to do that. So it's really a complicated question that has a really complicated answer. So here, let me give you an example. I graduated from a top medical school, all right? So to go into neurosurgery, you must be the top of your medical school class, like probably top 10%. I was number one out of 175 students at a top medical school, USC, which is in Los Angeles. So it turned out, because of my research and people I knew, my mentor being Dr. Marty Weiss, the chairman at USC, and his support, and the head of pediatric neurology at Children's Hospital of Los Angeles, Floyd Gillis, and Roscoe Atkins, who was the head of neuropathology. These guys were my biggest supporters. And Udi Mendel, who's now at Yale University. He's the head of spine oncology. Anyway, all these people supported me and my application for neurosurgery. So I got into literally #1 program in the world, which was the University of Florida, Gainesville. I got the top choice of all medical students who wanted to become neurosurgeons was Gainesville program with Dr. Roten. So I was lucky enough to go to the top training program. Why am I telling you this? Because you need to understand, when I trained at UF, the top neurosurgery program in the world, we didn't do endoscopic spine surgery. They didn't do it. So even though they were the best, they still weren't doing it. And other doctors were. But the doctors that were pioneering endoscopic spine surgery were not American doctors. They were Korean, German, Dr. Sebastian Reuten, British surgeon, Dr. Knight, and Dr. Martin Knight. And the Koreans were Dr. Sang-Ho Lee, Dr. Gun Choi. So all this innovation's happening outside of America, right? And I'm thinking to myself, like, why haven't I been exposed to this in my training if I went to the best neurosurgery training program? And the answer is, here's the answer, here's the kicker. Because America, neurosurgery is incredibly corrupt. It's controlled by the companies that make metal plates, metal cages, plastic cages, bone graft, all those things that surgeons are putting in patients make billions and billions of dollars for these companies. So the companies are now invested into the universities where neurosurgeons are training, and they control what the spine surgeons are offering patients, and they're making them offer fusions and artificial disc, metal, that these companies are manufacturing, and then getting spine surgeons to put into patients. So that's what's happening. And this is the basis of our movie, Spine Scam. So if you go watch the movie Spine Scam, you'll understand why neurosurgeons and orthopedic spine surgeons are recommending invasive surgery and not this surgery. We don't use implants. We're not making anyone rich. This is all natural surgery. I'm just removing all these pieces of herniation out of this patient, but I'm not putting an implant in here. So those companies will literally go bankrupt if all the neurosurgeons started doing this procedure. So they don't let the neurosurgeons do this procedure. They don't even let them know about it. They hide it from them. As a matter of fact, the AANS, the CNS, the American Board of Neurosurgeons, they want to put me out of business so that nobody finds out about this surgery, because they don't want the surgeons doing it. The other problem is this surgery is not covered by insurance yet. Therefore, the surgeons would have to do it basically for free, or they'd have to ask the patients for money. I realized a long time ago, hey, if a priest or pastor can ask people for money to go to heaven, well, shit, I can ask for money for people to get out of pain, right? I mean, if they're giving you nothing in exchange for money, at least I'm giving you something, which is to be pain-free. I'm ending your suffering here. So I have no problem asking for money, because after all, the patients are getting something in return, and I have to pay my staff. I got to pay my bills, right? I don't think anyone wants to work for free. So I've got a big overhead. Look at those herniations. My God, we're still at the first disc. That's why. So number one, it's a corrupt industry. The surgeons are all on the take, and they're making $1 million a year doing surgeries that are highly invasive, and they're putting metal in people's bodies, okay? And doing this surgery, they don't get paid. I don't get paid. I make a lot less money doing this surgery. I make a few, maybe a few hundred to $1,000. If I did a fusion or artificial disc, I'd be making $10,000, $20,000. So I take a huge pay cut to do this. Why do I do that? Because it's not about the money. It's about being a good doctor. It's about helping people do what's right for them. That's why I went into medicine. Nothing wrong with making money as a doctor, but that's not my motivation here. My motivation is to basically be the first in the world to do the best surgery in the world for people. So I like that. That's what makes me happy. And I sleep well at night, knowing I'm doing what's right for my patient. So I think that answers the question. Henry, what do you think? Did I answer it?
Yes, that answered it. And
Yeah.
Thomas reciprocated by saying GREED is why, in my opinion.
Agreed. Just watch the movie Spine Scam. Put the link in the video, Henry. Spine Scam, folks.
Yep.
That's the first movie in the world made on the subject of the greed and corruption in the spine industry. Right now, I've got the American Board of Neurological Surgeons trying to basically, they're fucking with me because they're so upset that I have pioneered a surgery that for 20 years there's been 0 complications. Yeah, they are. Yeah. No, the problem there. Look at the herniation that just came out. You see this? Look at that, Henry. Check this out. I just pulled this out. It's huge. Put the thing there. I mean, huge, of course, is a relative term. It's 6 millimeters. It looks like a little asteroid. But I've been pulling these things out for the last 15 minutes. So hopefully that's the last one. I need my scope. Long story short, the American Board of Neurological Surgeons, it's a board. It has neurosurgeons on the board. And those neurosurgeons are the ones that are getting kickbacks. And they're going to, of course, be upset with me for saying this. They're not all getting kickbacks, but some of them are in the form of consulting fees, royalty fees. But more importantly, they bring a lot of money to the American Board of Neurosurgery. So in the old days, the American Board of Neurosurgery used to be all about the truth, educating doctors and making sure that we know like the best treatments for the patient, that we're trained on them, that we're applying them in our practices. Now it's all about greed and money. Okay, I'll give you an example. I just took our annual recertification test, and this year and last year they had the same papers on spinal cord stimulators for back pain. All right. Now, first of all, neurosurgeons, well, for our test, it's like a 3-hour test that we have 6 or 7 journal articles we have to read and then answer questions, right? So it's a CME, continuing medical education, once a year. And you can imagine those articles are important articles. So the board picks them. Well, for 2 years in a row, one of those articles is on spinal cord stimulators for back pain. Now, why would that be? The answer is simple. Spinal cord stimulators should never be used for back pain, but the companies that make them are making billions of dollars by convincing doctors to recommend them to patients and putting them in, because the reimbursement from insurance companies is so high for those. But they don't work. In my opinion, they don't work. But the And neurosurgeons don't normally put stimulators in. Okay, we don't. But they're trying to convince us to recommend it to our patients through our own board certification exam, which should be completely unbiased and non-commercial. So they should all be recommending this surgery, not spinal cord stimulators. And I know why they're recommending spinal cord stimulators, because there's some kind of a kickback going on. I can't prove it to you because I don't know who and how much and how, but you better believe it. You just follow the money. Follow the money. Follow the money. Yeah. To them, success is when the patient gets 50% improvement in their pain. To me, that would be an absolute abysmal failure. These patients with this laser surgery have never gotten 50%. Okay, if I had 50% pain relief, I would stop doing this surgery because that's a bad result. Our success is 99.6. That's 100% if you round it up. So this is the right treatment to be recommending to patients, not stimulators that 80% of the patients get 50% relief. And of course, they're still on narcotic drugs. Okay, they're still taking pain meds. And they've modified their behavior. They're not engaged in physical activities that they want to do. So it's really just a lie and a scam. And that's the situation. I'm the only guy talking about it in the world. Partially because I believe in people should know the truth about their health care, and people deserve the best. That's the way my father brought me up. He told me always do what's best for the patients. And I believe that. You as a doctor should always do what's best for the patient, not what's best for yourself. So anyway, for me it's a no-brainer. Look at that piece of herniation. We're still on the first disc. We've just taken out so many pieces of herniation. It's unbelievable. All right, but that should be it. That should be the last one. I'm going to move on to the next disc in just a moment. I don't really see much left. There's still some pieces right here, and then I'll be done. But you can see the nerve root down there is decompressed. So I hope that answers your question. Tim, is it Timmy?
Timmy boy.
Timmy boy.
And he, no current questions, but we do have a comment from Timmy boy saying, great explanation, love the perspective. I'm in the process of speaking to Kim to get my surgery scheduled for 3 levels. Been watching your live stream for years.
All right, cool. Thank you. Yeah, this is the way to go, my friend. All right, we're done with this disc. We're going to move on to the next one. You can see, guys and gals, this is the incision. It's 4 millimeter, tiny. There's no metal plate. There's no screws. There's no cadaver bone. This is just some antibiotics. We've never had an infection with any of these surgeries, never, in 20 years, because it's minimally invasive, because we're clean. We have a very clean facility. I've got my team over here, Luis and Nikki and Jordan, and they are amazing, and Sam, and they do all the sterilization. And we've got the best sterilizers in the world, Belly Meds. All right, and we invest in the best equipment because we want the best results for our patients. That's what Deuk Spine's all about, just having the best. You want the best result, you invest in the best stuff. Drugs, equipment, staff, surgery, That's the way I believe. Anything else? Questions, comments?
At this moment, no. Oh, we do have a comment from Thomas once more on YouTube saying Western medicine generally wants permanent patients.
Yeah, you're right, Thomas. Permanent patients. I don't want permanent patients. I want people that come, get fixed, and go away. Yeah, Western medicine. Tom's right. Western medicine, think about it. We can cure back and neck pain, but all these doctors are recommending pain management and drugs and therapies, and those things will never, ever, ever cure back and neck pain. Never. Okay, never. Because we've been doing them for a long time, and they haven't cured it. Shot? All right, so I've got my dilator here, and I'm going to move out of this disc, 6-7. Shot, come on, Jordan. And I'm going to move up to 5-6. This is called the Deuk Spine slide or shuffle. I pioneered it. Shot. And when I learned the anterior cervical transdiscal endoscopic procedure, which is what you're watching, from the Korean, Dr. Seng-Ho Lee, the president and founder of Woodidal Hospital in South Korea, he was the pioneer. When I learned it from him and Dr. Gun Choi, they only did one disc at a time because they didn't know how to do this slide part. So I invented the slide so I could do more than one disc because, let's face it, what patient wants to have one disc at a time if you have 3 discs to operate on? All right, perfect, lateral. So I figured it's not right for the patient to have to come back 3 times and have surgery 3 times. All I got to do is figure out a way to get from one to the other, so I did. We've been doing the slide for 20 years. All right, there we are. Give me an AP. AP means front, back, anterior, posterior. Remember, we're navigating shot, quick shot. All right, a little bit to the, actually, it's really good. Lateral. To navigate in a 3-dimensional system, you must use 3-dimensional information, right? So this is called biplanar fluoro. Biplane means 2 planes, two dimensions. And to get 3-dimensional information, you have to take biplanar fluoro in multiple planes. You have to take it, come on, AP and lateral. You have to go front, back, and you have to go lateral. Shot. All right. A little bit on the left, but let's see where we are. Shot. Oh, Jordan. All right, I want to see if I can move this over just a little bit. Yep, shot. All right, I moved it over to the patient's right a smidgen, and I need to see if I'm still centered. Shot. That's perfect. That's exactly where I want to be. All right, so I'm going to go in, lateral. Once again, if you're working in a 3-dimensional system, which we are, that's the disc is 3-dimensional, the spine is 3-dimensional, the neck is 3-dimensional. You've got to use more than one plane so you can summarize or summate the information in your brain. So the brain becomes like a computer. It is a computer. Our brains are the very first computers on Earth. The human brain is the very first supercomputer on Earth. And what?
No disco?
No. Disco? So, you've got to process information, numbers, values, and reconstruct things in your mind as a surgeon. Surgeons are very good at 3D. That's one of the requirements to be a surgeon is you have to understand 3-dimensional anatomy. And it's funny because in med school you see students who really struggle with 3D. I struggled with 3D, but I sat there and forced myself to learn it. I literally just spent, when everybody else went home, they were done studying, I just stayed in the library studying and trying to understand the 3-dimensionality. And the hardest subject in medicine to know 3D is neurosurgery, neuroscience, basically neuroanatomy. Neuroanatomy is the hardest subject in the first year of med school. Everybody takes it the first year. It's the hardest, and that's the subject you take at the end of the year once you've taken general anatomy and you start to understand 3D concepts with like the pancreas, the gallbladder, the liver, nerves, blood vessels. Because the brain, everything is so compact and small, and it's 3-dimensional. So neuroanatomy is the hardest class in the first year of med school. And that's the class, I mean, I aced them all, but that was the class I had like literally a 99 percentile at the end of the year, at the end of the course. And I think the next highest score was a 91 percentile. So I really excelled in neuroanatomy and 3 dimensions, but it took a lot of effort for me to do that. Like being smart is not natural to me. I have to work at it. When everybody else spent 8 hours, I spent 16 hours. It did not come easy for me. It came really hard. But I stuck it out. I just invested the time and effort, learned the 3-dimensional anatomy, and did really well. And they actually invited me my fourth year to come back and teach neuroanatomy at USC, and I did. And they paid me the entire year of tuition for a 6-week course of teaching. It was basically a gift. And I was on student loans the whole time. I borrowed a lot of money, I think 40 plus 10. So what is that, 120, 130,000 I had to borrow from med school. And I ended up paying it off after residency 7 years later. And it was like almost $400,000 at that point with the interest rate. I love that low interest student loans, you know, at 8-9%. I mean, it's funny. No, they're like, oh, it's low interest student loan. I'm like, what percentage? 9%. I'm like, oh, I didn't know 9% was low, but okay. I mean, you don't have a choice. Like, how are you going to pay your tuition? Tuition was 30 grand a year at USC, and I lived off 10,000 a year. That paid for my room and board and food. 10 grand a year, and I did that for whatever, 4 years at USC. Look at this bone spur, man. That thing is bad. Right in the foramen on that left at 5-6. All right, so we got to get out here, get rid of this herniation, get rid of the bone spurs. Everything is going really well for this patient. He's doing fantastic in case his family's watching and they want to know. I'm very happy with the progress. I will say the surgery is a lot harder than I was hoping for, but you know, that's the way the cookie crumbles. Some people are easier, some people are harder. In the end, you just get it done. You do what's best for the patient. What do you got, Henry? Any questions?
We have a comment coming from another Thomas on YouTube.
Is his name another Thomas, or is it just another Thomas?
It's just another Thomas.
All right. Fair enough.
Saying, I understand it's sometimes necessary, but in my opinion, quote, pain management makes things much worse. This doc is an absolute rock star.
Thank you so much. I've got a rock star team, okay? Just to be clear, I appreciate you saying that, but my team is a rock star. My team is a rock band, right? You like that? I've got literally the best team I've ever had in 20 years of doing this, and I couldn't ask for better people. I couldn't ask for better equipment. I mean, honestly, I'm so happy. The only thing I can ask for is pepperoni pizza light on the... I'm just kidding. The only thing I could ask for, honestly, is to scale this thing up so I can help more people get out of pain. I hate seeing people suffer. Ever since I was a kid, just a little kid, I didn't like seeing people with crutches, wheelchairs. I hated it. It really tore me up inside. I felt so bad for these people. I still do, even now. I wish I could help everybody. And the only thing keeping me from helping everybody is money. I just don't have enough money coming in to build a better facility, a bigger facility, and to help more people. And it's the insurance company's fault, to be honest. They don't want to pay for these surgeries because they know they work and they know everybody's going to want them. So they're going to spend more money. It's unfortunate, but that's the society we live in today in America. And other countries too. All right, this is going well. I'm going to start making my way towards the middle of this disc. I've got to flip my rig around and start coming back the other way. Now, Henry, what videos do we need to show our audience? What have we shown them?
We have shown the 30 causes of neck pain and what causes neck pain, discogenic neck pain.
All right, let's show them how we're fixing it with this laser.
Of course.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debreeds the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Yeah. Welcome back. I'm just going to tell you guys, look at all this herniation. It's so scarred up. This is not a fresh herniation. Fresh herniation is white and fluffy, like a little fluffy cloud. This is just like cheese, like Gruyere cheese, just stuck down from all the scarring, from all the chronic inflammation going on in this guy's disc. You can see the fibers of the posterior longitudinal ligament back there. All right. Let me show it to you in just a second. Man, that is some herniation. Damn, this is like really one of the worst I've ever done. You guys see the fibers down there, PLL? That's behind the disc, right? Right behind those is the spinal cord. So this stuff here is just sitting right on the PLL and right on pushing onto his spinal cord. Right there is a tear and a herniation going through. I'm actually working up a sweat. There's some more fibers of the PLL. You guys see that? Back down there?
Yes, we do.
They run left to right or up to down, basically. This is all herniation right here, this white stuff. Amorphous. Amorphous just means without shape. But you can see the PLL fibers there, posterior longitudinal ligament. And there's a tear right there in the PLL. You guys see that where the herniation was kind of sneaking out right there? Right there.
Yes,
We're
we do.
not going to let it get away. I bet you this patient's seen Invasion of the Body Snatchers. Luis, have you? Who likes horror here? Who likes watching horror? Anybody on my team like horror? Thrillers?
I like it to an extent.
Something wrong with you guys. All right, take it out. Now, I'm moving the tube around just to kind of get everything cleaned out. But you can see things are moving easier. The bones are moving, like the bone on the left is moving relative to the bone on the right. So we've taken a disc that wasn't moving at all because of all the scar tissue here, scarring one bone to the other, and we've added movement to it, right? Now he's got movement back. How much movement? Not a lot. Probably about a degree of movement, like rotation. Look at that herniation just going right on out, pushing on the spinal cord down there. That's crazy, isn't it? It went right out through the PLL. That's digging into his spinal cord. And look at it, it's calcified too. But look at how I can remove it with the laser, literally 1/10 of a millimeter at a time. Doesn't get more precise than that, folks. All those fibers that run left to right are posterior longitudinal ligament. I like it when the herniation doesn't go past them, but I don't get what I like all the time. So it makes my job easier when it doesn't go past them, but this does. You guys saw it went past the PLL, all right, right here. You can see that. I think I cleaned it out pretty good. I'm pretty happy with this. We're just about done with 5-6. I want to get a little more herniation over here. But you see how scarred up it is. All this white stuff is herniation, scar tissue, and calcification. And it's sitting right on top of his nerve right there. And that's what I'm cleaning up. But it's very difficult because it's so much inflammation. This guy's body's been attacking this thing for years. There goes a piece of herniation. There goes another. They're coming out of the foramen. Well, there's another. We just took 3 pieces of herniation off his nerve. And that was on his, what side am I working on? His right side. His right nerve. That would be the let's see, we're at 5-6, so that would be the C6 nerve root on the right. The right C6 nerve root is out there in that foramen, right there at the bottom. And all these pieces of herniation are literally crushing his right C6. Now the right C6 would be the biceps on the right side. So his right biceps was going to go too. Oh, look at that thing. It's coming. Oh, it's a monster. It's coming out right there. Oh, yeah. Goodbye. That's another piece of herniation. Man, this poor guy, man. I don't know. I haven't seen this much herniation, I don't think ever. He was assaulted. And that might explain it. Huh? This is worse than the first case. Yeah, the lady from the first case, she actually can lift her arm now. She wasn't able to lift her arm before. And it's still weak because the nerve needs time to heal. But our first patient we did earlier today has already got a lot of her strength back. Look at all this herniation. I'm so happy. Yeah. She's going to do great. So is this guy. This is so much herniation. All right. I apologize the surgery has taken so long, but you know, you never know what you're going to get when you get in, when you meet patients. Nope, missed it. All right, it's not coming out, so I got to go back in. Try to break it up into smaller pieces. We're almost done with 5-6, then we're going to go fix 3-4, 4-5, which are, believe it or not, even bigger herniations. Look at that, I cut the herniation in half. Now it's coming out. At least the first half came out easy. The second half is giving me a hard time. Come on, get out of here. It's like evicting a bad tenant, you know? All right, looking clean. Up, still a little more. Remember, this is all sitting on his right bicep. I can't believe that he didn't have more symptoms in the right bicep. Maybe he did, but if he didn't, he was going to. Because those things are loose fragments. That means they're more recent herniations. It may be that he kind of put this off for a while and then now started getting symptoms in his right bicep. Maybe that's why he finally decided to come in and get this done. I don't know. That kind of makes sense to me. All right, we're just about cleaned out. Look at that, it's beautiful. Just get a little more of this grunge. All this stuff is just herniation and scar tissue sitting right there on the nerve and the spinal cord, but we're pretty much done here. I think he's going to do fantastic when he's done. Damn, nice. You guys see all the remodeling that the laser did on that bone right there? Getting rid of bone spurs. Okie dokie, artichoke, just about done here. Any other questions?
Yes, we have a few questions. This next one is, you're not going to believe it, is not Thomas nor the other Thomas. It's Tom Purr on YouTube.
Tom Purr. Yes, nice to meet you.
Asking,
thanks for joining.
Without getting you too upset, is there any hope on the horizon for your procedure to be covered by insurance? I am retired. I am a retired handicap and don't have the ability to come up with out of pocket.
Yeah, I'm so sorry. Yeah, I think there is hope for you, and there's hope for everybody. What we need, folks, is I hate to say this, but we need Donald Trump to take a personal interest in medicine and what's happening with the health insurance companies. If Donald Trump, and I think he might, I don't have a lot of confidence, but he just might realize that the biggest enemy of America today is the health insurance industry.
He hates Obamacare.
Obamacare was a joke. Obamacare just made the health insurance companies richer. All right? And all of them are just making trillions of dollars a year in profits, denying treatments. Last year in America, 850 million tests and treatments were denied by the insurance companies, okay? Thomas, last year, according to the Wall Street Journal, look at that piece of herniation. That's amazing. Goodbye. All this is being done without metal or fusion. Okay, last year, 850 million denials by health insurance alone, according to a report in the Wall Street Journal published in February 12th of this year, okay? Think about that. I get maybe 300 denials a year for my treatment, my laser surgery. The problem, the fuck? The problem is not my 300 denials a year for my treatment. The problem is the 850 million denials a year by the insurance companies. So who's stopping them from denying? Who's holding them accountable for those denials, for not authorizing treatment? The answer is nobody. That's what they want. They want nobody. Come on, laser on, let's go. The case isn't long enough for you? That's the problem, is that the insurance companies don't answer to anybody but the lawmakers. And the only way to get them to pay for this is to sue them, or to get the lawmakers to change the law so they can't just deny it. And I don't think the lawmakers are going to come to our rescue anytime soon. Maybe they will, but the only way is with Trump leading the charge. And I don't know. I don't really understand his relationship with the insurance industry, whether he can really take them on or not. I personally think the insurance industry is too big for Donald Trump. I think so. I don't think he can handle them. They will put a bullet in that guy's head, okay, before they let anyone take away their profits. They are the most vile, corrupt organization on earth. You think drugs are killing Americans, for sure. I think drugs are horrible. But there's only one thing killing more Americans than drugs, and it's not tobacco. It's insurance companies. By denying treatments like cancer treatments or spine surgery, or paying for treatments that cure people like this. Think about it. If this surgery, if they could not deny this surgery, then everybody could get it and nobody would take narcotics, right? And there would be no pain. If you had back pain, no more narcotics because the pain's gone. Okay? So basically this is a game-changing surgery. Why? Not because it's minimally invasive, not because it's endoscopic, not because it's laser, not because it's Deuk spine, because it actually will cure the back and neck pain. That's why. And when you cure back pain, the number one reason doctors prescribe opioid narcotics or medical THC, marijuana, is because of back and neck pain. So you will be getting rid of the number one cause of drug addiction in America and the rest of the world. Huh? Yeah, different. We're going to take this out and we're going to put another hole. Turn the scope off. Thanks. We did 5, 6, 6, 7 through that incision, 4 millimeter. We're going to make another incision a little further up because after all, we want that vampire got me at Deuk spine look. Even though Halloween was last week. Was it last week? No, it was last month. Man, it just seemed like the other day. Little kids were at my house. They raided the candy too. Oh, I don't know how many kids I got, but they sucked the candy jar dry. Like 3 times over. Huh? It's good. I think it's great the kids get out and do Halloween. All right, there's your incision. That's the first one. No bleeding. We lost 5 drops of blood the whole surgery so far. We did half of it. There's your incision, okay? So now I'm going to go up to 3, 4, and 4, 5. You guys ready? Now there's a reason I did it this way. Because the neck is thinner up here, and it's easier for me to feel the spine. It's not easy, it's easier. All right, let me have the needle. And we need it a little bit easier at this stage. All right, 3, 4. So I need to be a little bit higher. All right. Shot. All right, what is that? 4, 5 there. 2, 3, 4, 5. Let me go a little bit higher. Shot. Shot, AP. Give me a quick AP. Quick. Shot. Yeah, my fingers are killing me. I'm a little to his left. Come back. Shot. Shot. All right, 2, 3, 4, 5. Everyone agree? 4, 5, yes. Give me an AP, Coker. Sorry, folks, this is the hardest part of the surgery right here. Shot. Perfect, right in the center. I love it. Great. So far, he's doing amazing. Everything's going in his favor, which is good. We like that. So we are now inside the next disc, and we're going to make a second incision to do these two. 3, 4, 4, 5. Shot. All right, we're going to do our discogram. Shot. Oh, look at the size of that herniation. It looks like an asteroid. Look at that. Show us the herniation. It's massive. Oh, this is going to be another long disc to fix. And the one after, I'm sure, as well. Okay, any questions?
Yes, we have a question from the first Thomas
Shot.
on YouTube asking, Dr. Deuk, have you ever seen the movie Law Abiding Citizen with Gerard Butler and Jamie Foxx?
Oh, I'm thinking I might have. I feel like I have. I feel like Gerard Butler was the bad guy in that one.
He was.
I don't. Huh? No.
He was.
Oh, never mind. All right. I don't remember seeing it. I gotta go watch it. Law-abiding citizen. I gotta watch it. I like both of those actors.
It was because of revenge. He was acting out revenge.
Oh, okay.
It's a great lawyer movie.
Oh, lawyer. All right. Good.
Was he a lawyer in this movie?
Jamie Foxx was.
I just remember one where he was the bad guy. Like he was trying to destroy something like the White House or something else. I don't remember.
Well, that was White House Down, and he was the president's security guard for that.
Was he good or bad?
He was the good guy, yeah.
I'm so sorry. There was one where he was the bad guy. I don't remember what movie it was, but he was the bad guy in one of them. Maybe that's why I remember when he was bad, because he was good all the other times. All right, law-abiding citizen. Henry, you'll remind me to watch that one.
Oh, yes.
All right, folks, we made our second incision. That way we get the official vampire look for our patient. I think he's going to like it. He's all tatted up. He's very proud of his tattoos. And one of those tattoos is the New York Yankees. All right, so I know Henry's not happy about that.
I'm a Mets fan.
Sorry, but
It's okay.
anyway, this perfect vampire scar. Now he can say, "Oh, I know what he can say. I know what he can say." All right, I'll tell you what he. Oh, by the way, you guys see the herniations right here?
Yes, we do.
Just kind of they fell out of the tube from the last couple of discs. You guys see them right there?
Yes, we do.
I'll just put them right there. All right, one of my favorite movies is a movie called From Dusk Till Dawn. How many of you guys have seen Dusk Till Dawn?
I've seen it.
Great movie. Oh my God, one of the best. So now he can say he was at the, what was the name of the hotel?
I'm trying to remember. I know what you're talking about. I'm trying to remember. I haven't seen it in a while. But I'm looking it up.
Yeah, it was in Mexico.
100%.
Yeah, the hotel was in Mexico. The movie took place in Mexico. So he can say he went to Mexico and went to that hotel. Huh? No. What the heck was the name of that hotel in the movie?
That's what I'm trying to find. It's not letting me find it.
Come on. Give me a little inline. Berndes, inline. Are you okay? Let's get the blood pressure down.
It was called the Titty Twister.
The Titty Twister. I don't make this stuff up. Are you guys ready?
Very true, yeah.
Tell me when you're ready. Let's go. 1, 2, 3. Not too hard. Shot. Man. Yeah, we're getting there. There it is. There it is. Right there. Perfect. Relax for a moment, then we're going to go back to pulling. So what we're doing to get deeper into that collapsed disc, because it's all scarred up, doesn't want to let us in, is we're literally putting a little distraction on his head, like pulling his head north a little bit, and pushing his shoulders down a little bit. So that kind of opens up the disc space just a millimeter, and it makes it so I can get to where we need to go. Shot? It's called inline traction. Inline traction. It's used by lots of people, chiropractors, neurosurgeons. All right, heading to the back of this. Guys, give me a little inline on the count of 3. 1, 2, 3, inline. Inline. 30 seconds more. Perfect, done. Did it. All right, we are literally at the back of the disc. You guys see that, Jordan? Show them the tube. 4mm tube, 4mm skin incision. That's why there's no bleeding. And we are at the back right by the herniation. So we're going to go get out as much of this herniation as we can. The Titty Twister, From Dusk Till Dawn, one of the best movies, best quasi-horror / humor. And it's got George Clooney. It's got Quentin Tarantino. Yeah. It's got so many famous actors. Huh?
Selma Hayek.
Salma Hayek, oh my gosh. If you like Salma Hayek, this is the best movie she's ever been in. That was the first time I ever saw Salma Hayek. It blew me away. I don't know if it's her first movie, but that's the first time I ever noticed Salma Hayek. Let's put it that way. Oh my God. And you may not recognize her in that movie. I can tell you that right now. You may not recognize her. But if you like Salma Hayek, or if you like Latinas, let's just say that, then that is the movie to watch. All right. Sorry. As I digress. All right, what do we got here? A lot of herniation. Yeah, but don't go watch the movie now. Wait till this is over. All right? I'm just kidding. Just kidding. Go watch it if you want. It's better than Instagram. All right. That was from the days way before, you know, a lot of this digital stuff, digital media, right? It had Harvey Keitel. Harvey Keitel?
It did have Harvey Keitel, correct?
He was a priest, I think. Was he a priest?
Yeah.
He was.
He's one of my favorite actors.
And they had that girl from, oh my God, Christmas Vacation, I want to say. The daughter from Christmas Vacation.
Oh, yeah, the
Griswold daughter.
The Griswold, yeah. Yeah, I think so.
Oh, my Lord. This guy's got a massive bone spur here. You guys see that thing?
Yes, we do.
All right. How does this guy get so lucky to have the worst herniation I've ever treated and to have the biggest bone spur? I know, I understand they hurt him bad, but, you know, I'm not happy about this bone spur. When I see bone spurs like that, it's kind of huge, you know? There's only so much I can do with a bone spur like that. Makes my job a lot harder. See, disc herniations are much easier to remove than bone spurs. And that's for any type of surgery, any type of surgeon. All right, well, there you go. This just went from a level 10 to a level 20 in terms of difficulty. This literally just became the hardest case of my entire career with this giant bone spur here. All right. Yeah. I guess only one person gets that award. Henry, anything we can show our audience?
Oh, yes. We can show them how the Deuk laser disc repair is compared to all the other invasive neck treatments.
Yeah, good. Let's do that.
Let's do that.
because I'll be here for a little while working on this.
Of course.
I'm Dr. Aro Jugmejian, CEO and founder of the Deuk Spine Institute. I'm here to talk to you today about neck pain and its common treatments. Neck pain has different causes. The most common cause of neck pain is a herniated disc. Herniated discs account for about 85% of chronic neck pain. The second most common cause of neck pain that's chronic is the facet joints. There are facet joints on both sides of the spine, left and right. There is one facet joint for every disc. Facet joint pain requires a different kind of treatment targeted at the facet joint itself. For disc pain, which accounts for 85% of neck pain, the best treatment in the world is the Deuk laser disc repair. It is the most advanced treatment that is the safest and has the highest chance of successfully eliminating symptoms. Let's talk for a moment about what's important for patients who are considering treatment for neck pain coming from an injured or damaged disc in their spine. The most important thing for patients, number one, is getting rid of their symptoms. The type of symptoms that disc herniations or disc injuries can cause include neck pain, headaches, and symptoms down the arm, such as weakness, numbness, tingling, or even pain shooting from the neck down into the arm. The symptoms of neck pain include disc herniations, which are the most common cause, and patients want those symptoms gone. That is their number one priority and goal. The second most important goal for most patients is to avoid a complication from the treatment. Medical treatments do have complications, and the more invasive the treatment, the more likely a complication will occur. Complications from surgery, for example, can include blood clots, pneumonia, heart attack, infection, failure of the spine to heal properly after surgery. There can be implant migration or implant failure, adjacent segment disease, and vascular complications such as injury to the blood vessels or nerves in the neck, including the trachea and esophagus. Nobody wants a complication from spine surgery on their neck, so less invasive is typically going to be a better option to avoid those complications. The third thing patients really want when they're looking at treatment options for curing their neck pain is they want a quick recovery. People want to get back to a normal life as quickly as possible. They want to go back to their activities, they want to be active, they want to play sports, and they want to go back to work. And finally, the next thing to consider is long-term results. For example, if you have a treatment today and it works, how long will that treatment last, and will it create additional problems down the road for you? Treatments like spinal fusion that are invasive typically result in the need for additional treatment such as pain management, physical therapy, and possibly additional surgery. We're going to look at each of these individually and go through each of these options individually. So we're going to start with more invasive treatments that are typically recommended for patients with herniated discs or degenerated discs in their neck. The most common treatment recommended around the world is anterior cervical discectomy and fusion. That is a surgical treatment where the entire disc is removed surgically through a large incision that is very risky. There's bleeding associated and risk of injury to surrounding structures such as the esophagus, trachea, and blood vessels in your neck. Complications are very common with this type of surgery. The complication rate is accepted at 48%, which is a very high number. So if you're considering ACDF or anterior cervical decompression and fusion, you are looking at a very high complication rate. The success rate of this surgery at eliminating neck pain is very low. It's somewhere on the order of 25%. That is the generally accepted success rate at eliminating neck pain. An additional treatment that you can consider is artificial discs. Artificial discs are very similar to ACDF. The difference is instead of fusing two bones together with a metal plate and a cage, we're actually putting in a mobile disc made out of metal and plastic that moves. The problem with the movement is that these discs do pop out of the disc space. Over time, they can fail. They can cause collapse of the vertebral body above and below through fracturing, especially in patients with weak bones, such as osteopenia or osteoporosis. Those types of patients are at high risk for complications from both ACDF and artificial discs. Another complication from artificial discs is that you can develop facet joint pain and adjacent segment disease. Very common with artificial discs and fusion, and they typically have the same rate of adjacent segment disease. There's also a long recovery associated with both ACDF and artificial disc. Recovery can take months to years, if recovery even happens at all. There's tremendous scarring in the wound associated with ACDF and artificial disc, lots of scar tissue, lots of pain, and lots of problems after these surgeries that are invasive. Alternative treatment would be to go in the back of the neck and do a cervical laminectomy and fusion. Again, large incision, high chance of complications, very long recovery, taking years to recover. All three of these types of surgeries, ACDF, artificial disc, and posterior cervical laminectomy and fusion, require the use of postoperative narcotic painkillers. Narcotic painkillers are opioids. They are dangerous. People get addicted to them, they can be abused, and people can overdose. It's easy to overdose on narcotics because you want to keep taking them to treat the severe pain you're going to have after these invasive type surgeries. The severe pain can last weeks or even months, and the addiction can happen very quickly. Let's move into less invasive treatments such as epidural steroid injections. This is a treatment commonly recommended by pain management doctors. They stick a needle into your spine and inject the steroid medicine to reduce inflammation. While this treatment can be effective at temporarily giving you relief for a few days or even a few weeks, the pain always comes back from a herniated disc because the source of pain is never being treated. The annular tear and inflammation within the annular tear is not treated by an epidural steroid injection. The steroid goes throughout your body and causes systemic side effects such as high blood pressure, elevated blood sugar. In patients with diabetes, this could put your sugar up into the 300s and 400s, which is very dangerous for patients. So steroids should be avoided as much as possible. Next, let's turn to spinal cord stimulators. The problem with spinal cord stimulators is they are highly invasive and they are frequently put into patients by untrained doctors who are not surgeons. These doctors are typically pain management specialists, and they're putting these stimulators in patients not because they can cure your pain, but because it's another treatment that they have up their sleeves. These treatments with stimulators pay these doctors obscene amounts of money. The profit for the doctor can be in the tens of thousands of dollars. Avoid spinal cord stimulators. They do not work, they're dangerous, they put you at tremendous risk, and in the end, basically you're taking this device, sticking it on top of your spinal cord and putting a pacemaker under your skin that you're gonna have to live with for the rest of your life. They cause scar tissue and they frequently migrate and get out of position. Next, we're going to talk about physical therapy. While physical therapy has many benefits, such as keeping you toned and fit while you're struggling through the pain and trying to stay mobile, but physical therapy will never, ever cure pain in the neck from a herniated disc. It will just try to keep you active and from getting more and more sedentary and developing deconditioning of your muscles because you're sitting around because you have neck pain all the time. Finally, let's talk about the Deuk laser disc repair. The Deuk laser disc repair is the solution for neck pain. If you have a herniated, bulging disc, extruded, ruptured disc, protruded disc, or degenerated disc, the Deuk laser disc repair works by minimally invasive treatment going to the back of the disc where the problem is coming from. This is the tear in the back of the disc that has inflammation, and using a laser that is extremely precise. The laser fiber itself is 0.5 millimeter or half a millimeter wide, and the endoscope allows me to see 1/20th of a millimeter. I can directly see the nerves and spinal cord. It is an extremely safe treatment. As far as results go, the Deuk laser disc repair has the highest success rate of all the treatments we've discussed so far. We have a 99% cure rate of neck pain coming from herniated discs, and the Deuk laser disc repair has 0 surgical complications to date. Our patients have an immediate recovery. In 1 hour, they're leaving our facility and they're going back to their hotel room. They usually drive themselves in the next morning for a quick checkup, and then it's back to a normal life. Well, I've enjoyed talking to you, and thanks for taking the time to listen to our video. I'm Dr. Ara Deuk-Majan. We'll also find this on our podcast at Deuk Spine Institute Podcast. Thank you. Folks, we are almost done with this disc. He's doing great. This was digging into his spinal cord right here. You guys see this? There was a bone spur pushing in and a herniation. And now I've removed it. All that's left is a little bit of herniation here. which I'm going to remove, but there was a gigantic bone spur pushing right on his spinal cord, digging into his spinal cord. So that's why he had some spinal cord issues, some myelopathic findings, and hopefully it's going to resolve now that we got the pressure off. So he was just going to end up eventually being paralyzed because of all the pressure on his spinal cord coming from that bone spur. Now, why was there a bone spur there? That's the real question. The answer is, when you get so much inflammation related to a herniated disc, so much that your body is producing all this inflammatory mediators right where the herniation is, right here at the back of the disc, which is what's happened in his case. He has massive inflammation back here over the years since his accident. Basically, that has calcified over time. That's what this gold stuff is right there. All right. Now look at that. There was indented. It was like a crater of bone spur and herniation pushing onto his spinal cord, and now it's all gone. So we're pretty much done. I just got to clean up a little bit more, and then I'm moving on to number 3-4. But this is our second to last herniation. We've done 3. When I complete this one, we've done 3. And again, this is a level 20 out of 10. This is the hardest I've ever done. Why? Because I've never peeled a bone spur right off the spinal cord. I mean, that big. I've peeled bone spurs off, but never that big. There's still some more right here. You guys see this? Fluffy white stuff. A lot of it's scar tissue, but I've got to explore it to make sure it's not pushing on his spinal cord. That's what makes this surgery hard for every surgeon, is the scarred herniation stuck to the spinal cord. But this surgery with the endoscope is the best way to do it. Okay, there's no better way. And there you go. Just about done. Another 10 seconds and I'll be done. I've removed as much as I can safely, and honestly, I've never seen this much inflammation. This is bordering on something we call OPLL, ossification of the posterior longitudinal ligament. I think he has a component of that because he's got so much calcium on the PLL. All right, but we're done. Whew. All right, he's doing great, stable. His blood pressure stable, vital stable. We finished 3 out of 4 discs. We got 1 more to go. Little antibiotics. Any questions?
Yes, we have a question coming from Tomper once more on YouTube, asking, when you clean out the debris from a torn disc that has been flattened out almost bone on bone, how do you get that cushion area back between the vertebrae? Gravity will keep the disc area flat?
Yes, the disc area will never expand again. You don't need a full disc. The purpose of the spongy stuff in the middle of the disc is basically to hide it away from your inflammatory system so that it's not exposed to your body. So it's hidden inside the middle of your disc. Let me look at the MRI real quick. I just want to look at these. The disc I just fixed was really pushing on his spinal cord, and the next one is pushing on the spinal cord as well. So these are the two with the greatest amount of, compression and damage to the spinal cord. These are the 2 most important. All right, here we go. You guys ready? Shot? Is that it there? You could see the dye layering out where the herniation was. Shot? That's it? Shot? Shot? All right. Shot? All right, so my dilator is still in the disc. Shot. And I'm going to remove the tube, give it to Luis. Again, there's no bleeding. You guys see this? It's bloodless surgery. Why? Because we're not cutting through veins, muscle, fascia. We're literally spreading them apart. So that's all we're doing. I'm going to come out of 4-5 and go up to 3-4. You guys ready? Here we go. Shot. Just about there. All right, I can feel the bone spur in the front of his spine. I'm going to pop out of the disc right now, and I'm going to move up to the next disc, our last disc, C3-4. Shot. Want to check to make sure I'm in the middle. I am. Let's go. I'm a little bit off to, I'm pretty much center left, just center left. It's perfect. Shot. Last disc, number 3-4. Here we go. Shot. Shot. All right, AP. I look good on the lateral. I'm right in front of the disc. I'm going to go to the AP view, make sure I'm in center. All right, I'm off to his left. I don't want to be off to the left. I want to move back to the center. Stay there. Shot. That's perfect, lateral. A little bit off to the right, but not bad. I'm going to move a little bit more. That looks really, really, really good right there. I'm going to move a little bit to his left. It's a bit slippery here. Shot. Perfect. Now I'm going to elevate, and I'm going to anchor the tip into the ALL. And I'm going to little inline. All right, now, before I go any further, I want to check an AP view, make sure I'm in the middle. Coming into the disc, you want to come in the middle. Once you get to the back of the disc, yeah, it's perfect. We're in the middle. Once you get to the back of the disc, you can windshield wiper back and forth to get to the left and right for Raymond. But when you go in the front of the disc, you want to go in the center because that's an anchor point. You're going to anchor your tube to the front of the disc. It's not going to move around the front. It's just moving in the back. Shot. Everybody good? We're almost there. We need another millimeter, 2. Shot. That's perfect. I'm going to bring my tube down now. He's doing great. Fucking hell. Now this patient wasn't just having neck pain. He was having nerve damage from the herniations, and he was having spinal cord damage as well. We call it myelopathy. Guys, I need a little inline. You guys ready? Yep. All right. Well, let's do it. Yep. Tell me when you're ready. Are you ready? Yep. Here we go. Little inline. Perfect. I felt it go. Almost there. Almost done. A little more. I need just another millimeter. Give me a second. Shot. You can hear the bone spur. It's going to be another difficult one. And, yeah, I think we're done right there. It's about as good as I can get it. All right. Yep. Let's get that dilator out. This is our last disc we'll be doing. Any questions?
No current questions, but we do have a comment from the first Thomas on YouTube asking, you may need Godzilla grabber for this one.
No, I wish. The Grabzilla is for the lower back only, never for the neck or thoracic. And the Grabzilla is a huge, I wouldn't even fit down this thing. This is a 2.8 millimeter internal diameter tube. You can only use 2.8 millimeter. And the Grabzilla is like what, 6? Yeah, almost, actually 5.8 millimeter.
Yes. Yeah.
So, all right, so far he's doing good. We're almost done, one more disc to go. This will be another very, very difficult disc to fix. I'll do my best, and hopefully it's good enough for him. We'll see. All right. Any questions?
At this moment, no current questions.
Let's show the audience what facet pain is, because a lot of these patients, since you guys see what's happening, right? I'm removing the scar tissue at the back of the disc. I'm removing the herniation. So what happens is the disc starts to move once again. Like, for years it hasn't been moving. It's stuck down. See, right now I'm pushing on the tube and I'm not getting any movement out of this disc, which means the disc is just, the two bones are scarred together. Okay? So no movement. By the time I'm done, you'll get about a degree of movement, which is not a lot, but it's more than nothing. So when he starts to move, he may end up getting some pain called facet pain, facet joint pain. We have to be prepared for that. I told him about that. He knows about facet pain. I don't think he has it now. Could he get it? Yes. Will he get it? 25% of patients do. Then they got to come back and treat with the facets. Let's flip it. Oh, much higher patients after fusion get facet pain, yeah. Yeah, with Deuk laser disc repair, it's about 25. With fusion, it's about, at least 50. All right, 50%. Henry, let's show the audience. I've got about 10 minutes maximum left. Let's show the audience what is facet pain, how do we fix it?
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Extraterrestrials. All right, welcome back. You can see from the video that facet pain comes from facet joint injury. Look at the bones moving. You guys see to the left of my laser tip, that white thing? That's the bone above. And look how it's moving relative to the bone below. So I've already given him about a degree of movement. Oh, look at that herniation. That thing is massive. It's like a rock. This thing is pushing on his spinal cord here at 3-4. And I got to break it up. It breaks up nicely with the laser, very nicely. As a matter of fact, lasers are used to break up kidney stones. I don't know if you guys know that, but urologists use lasers. Laser lithotripsy, look it up. All right, there's the tear in the back of the disc and back of the PLL, and there's herniation right down there, and it looks like it may be pushing on the spinal cord. Okay, so I'm gonna have to go see what I can do to get rid of it. See all the bone spurs there? My God. That's why you need a precise instrument like the laser for this. It's all calcified, and my God, look at that. That's where the spinal cord's being crushed, right in there. I got to go clean it out. Again, this is the hardest cervical laser I've ever done in my career of 20 years. This guy has the hardest case. I'm giving him that distinction because it is true. I've never had a harder case. I'm literally sweating. It's so much work. I'm fighting. Huh?
All the ones you've done.
Everything. I've done 2,000. I'm literally fighting because the disc is, the bones don't want to move, okay? And I got to move them in order to get the herniation out. So I'm forcing these bones to move. And that's taking a tremendous amount of physical, force. But at the same time, you're right over the spinal cord. So you can't apply great force right over the spinal cord. Otherwise, something bad could happen. Neurosurgeons are very cautious about applying force, and how we apply force, especially around nerves and spinal cord. So I am right now trying to remove as much of this herniation as I can without applying excessive force. But it's impossible because look at all this giant bone spur, scar tissue. It's just holding everything together, forcing me to push hard. All right, I'm just going to take a break for a second because it is literally physically exhausting. I'm not trying to be complainer or anything, but I'm going to pull back a smidge, and I'm just trying to share my experience with you guys so you understand what I'm going through and realize that sometimes neurosurgery is not, easy. It's pretty hard physically. We all think of it as surgery that requires a very delicate touch, but when you're dealing with spine issues, you don't have the luxury of a delicate touch all the time. Sometimes you have to apply a force. I'm probably applying literally 40 pounds of pressure to this tube as I'm rocking it. And I'm getting a workout of 40 pounds easily, fighting this disc that's collapsed just to get it to give me the access I need. And so that fiber is 0.5 millimeter, and I'm moving it 1/10 of a millimeter. And that 1/10 of a millimeter gives me the exposure of the pathology, scar tissue, and herniation I need in order just to get it with a laser, right? So some people say, oh, give me a millimeter. I need 1/10 of a millimeter. Woo! I need what is that, Olivia Newton-John? What did she used to wear on her head? A headband or something? A sweatband? I need a sweatband. Jane Fonda? Fuck. I am literally drenched in sweat. Just to show you guys how hard I'm working. Do we have any questions?
At this
All right,
moment, no
5
clear
minutes,
questions.
5 minutes, 5 minutes. Almost done. We're cruising. No questions. All right, you guys are amazing. You guys know everything. I love it. Whew. Oh, look at that herniation right there. Oh, it's a biggie. Let's grab it. Oh. Well, I hope he appreciates what we're all doing for him. There it is. It's not as big as the one we got out earlier at 6-7, but it was about half that size. No, I'm almost done. I'm fine. That's why it's not as big, because it didn't come out all the way. We only got part of it. There's the other part of it. So I'm having to cut it in half. We call it bivalve. Bivalve is like a mollusk, like a mussel or a clam. And they're known as bivalves because they have two halves that are symmetric. So in surgery, you bivalve a lesion and get it out easier. I just bivalve that herniation. So it's a technique I learned, during my training as a neurosurgeon. When you take out a mass so that you don't hurt the tissues around, right, you would bivalve it. For example, if you got a brain tumor you're taking out inside the brain, deep in the brain, you don't want to hurt the cortex as you come out with the tumor. So you're going to take the tumor out piecemeal so that you don't damage the cerebral cortex, which is the part of your brain you actually use. I mean, you use it all, but the cortex is the part that's responsible for consciousness and awareness. Oh, all right. About 5 minutes. I feel cool air. What's going on here? Have you guys been holding out on me? Huh? You want me to hold out on the Christmas bonuses? Oh my God. Have you guys really been keeping the room warm? I'll go on a warpath. Huh? No, you guys have the room cooled, right? Yeah. I know some people like to keep it warm, but you got to think about the surgeon here. All right? You don't want me turning into a sieve dripping sweat all over the patient. That wouldn't be good. All right. Any questions? We're just having a little humor here, kind of breaking up the monotony of the surgery. And yes, it is monotonous. We're almost done. This is a herniation sitting out in the foramen on his right side at C3-4. And I'm just about finished. I am really fighting it, putting in about 40 pounds of pressure here on the tube just to get it to wiggle. When I first did this surgery 20 years ago, I remember I was scared to death about everything. I didn't want to hurt the patient, obviously. I didn't want to move the tube too forcibly. Now I realize the kind of force that's required in some of these patients to be able to move the tube so you can get to the herniation. All right, we are just about done. We got about 3 minutes left on this last herniation at C3-4. Look at all this stuff. It's just, oh, look at that herniation. It just came out of the foramen that was pushing on his left nerve root, C4 nerve root. It's hard too, and it's getting calcified. See the gold color? Calcium. Woo! How long has the surgery been going on?
I'm looking, it's been 1 hour and 53 minutes.
You mean since I started my incision?
Yeah.
2 hours.
Almost 2 hours, yeah.
Damn. You want to know something? Most neurosurgeons that do fusion, they would just be finishing 1 disc right now. So we finished 4 discs in 2 hours. That's really, really good. And we've lost what? 5 drops of blood, Dr. Berndes? 5 drops? That's nothing, folks. 20 drops of blood equals 1 ml, 1 cc. We lost 5 drops. His vital signs are perfect. He's doing amazing. I am just about done. I got to get this piece of herniation out. I'm not going to let it hide. Look how smooth its edges are. So this thing spit out. His body tried dissolving it through inflammation, which it ended up just collagenizing it. And then he put some calcium on it, made it heavy so it doesn't want to come out. Get the heck out of there. Go on. All right, folks, last chance saloon. Anybody know what movie that's from? I'll be impressed. Nope. Better than Clint Eastwood.
What was the quote?
Last Chance Saloon.
Is that
It
Cool
is.
Hand Luke?
No.
No.
It's a movie nobody has heard of. It's a comedy. Luis would love it. Luis, do you know?
I don't know.
I told you before. Why didn't you watch it? Yeah. All right. For God's sake, send Luis a link. Nothing but trouble.
Yeah. No. Yeah.
Nothing but trouble. I don't remember. Nothing but trouble, folks. One of the best comedies made. And if you're an 80s guy like me, you would love it. Dan Aykroyd.
I was going to say Dan Aykroyd, Chevy Chase, John Candy. Oh, my.
Exactly. Demi Moore.
How have I not seen this yet?
You're going to have to watch it.
Oh,
Oh,
yeah.
and they have a famous hip-hop band all around the world, or what is it called? Jeez, look at that. The spinal cord was getting crushed right here by this herniation. You guys see that? Just digging in. And we just zapped most of it away, probably about 70%. That's about as good as I can do. Folks, that's amazing. This guy's I think he's gonna do really well. He just needs to heal up. But that's it. We're done.
2 on and city on, please. Thank you.
I can go rehydrate. I need some Gatorade. You know, Dr. Cade, the founder of Gatorade, was at University of Florida. As a matter of fact, he sponsored our soccer team, the medical school the resident soccer team. So he used to drive up. When I went to UF for neurosurgery training, I met a fellow resident. He was a general surgery resident, and became friends with him. He played soccer. He had a team. He invited me to play with them. And the entry fee was $500 for the team and to play the league, right? So Dr. Cade, the founder of Gatorade, would literally pull up in the parking lot in a limousine, open the back window, and a check would come out, and he'd hand it to my friend, you know, and we would register and play soccer for the year. Just, he was a nephrologist. No, he was a nephrologist. So I never saw his face. Just a limousine and a piece of paper would come out the window. It cracked down about an inch. That was it. Yeah. We'd take the check. We'd register our team for soccer. We'd play for soccer. He loved supporting the soccer team. I don't know why. I mean, he wasn't my relationship. He was known to my friend. All right, folks, check it out. A vampire flew in here, fly, and sucked a little bit of blood. And this guy's got to watch. If you're watching this surgery, you're going to watch the movie From Dusk Till Dawn. Dusk Till Dawn. One of my favorite. With Quentin Tarantino in there and a lot of A-list actors. Great movie. Very funny. That's for another time. Thanks for joining us. Any more questions or comments?
Comment from Thomas C on YouTube saying, God bless you and your team, doctor. Happy Thanksgiving.
Thank you, Thomas. God bless you as well, my friend, and happy Thanksgiving to you. All right, everyone. Great job. Next case is going to be in room 2, piriformis, and then we'll be back here for a DLDR lumbar and an SI bilateral. I'm Dr. Deuk here at the Deuk Spine Institute with a patient who traveled here from Colorado with her husband, and she underwent the cervical Deuk laser disc repair for 2 herniated discs in her neck. And how are you feeling today?
Great. Even on the way home, I felt all the pain release from my arms and my shoulders. I didn't realize how much pain I was actually in. So my arms just feel light. And sitting in the waiting room here earlier, I realized my neck is not hurting at all and my headache is gone.
So your headaches are gone, your neck pain's gone, and your arms are starting to feel normal again.
Yeah, yes.
Amazing, isn't it?
Yes, so amazing. I'm so grateful.
Yeah. Tell me what life was like for you before you came to Deuk Spine Institute.
We have 4 small children, and it was very hard because we homeschool. My oldest started taking over laundry. I couldn't get in to the washer to get the clothes out. He has to help a lot with the little ones with school. I was in bed a lot with pain, and laying down hurt, so then I would sit up in the recliner, and I wasn't sleeping at all. Last night, I slept.
Congratulations. Now, are you feeling good here today because we gave you lots of pain medicines, or are you on any pain med at all?
No, I didn't even take ibuprofen. I think in the IV there was Tylenol. I didn't even take the muscle relaxer, no pain meds.
Yeah, the pain meds from surgery wore off yesterday.
Yeah.
And today your body has no pain meds and you have no pain.
No pain.
Congratulations.
Thank you.
Now, it must be hard with such a severe, debilitating neck and pain and headaches when you have kids because, you know, your whole life is all about having kids and bringing them up and engaging with them and being part of their life. And when you have pain like that, it takes your time away from your kids. It takes your quality of life away. So you had to do something about this.
Yeah.
And did you have any treatment in Colorado?
They wanted me to do an epidural in the neck because there was no room in the spinal cord. That made it worse because the fluid had nowhere to go. So I did that, and then the surgeon in Colorado wanted me to do a fusion and basically laughed when I asked if there was other options. So that's when it led us to do more research and watch all of his videos and know, I just knew in my gut this is where we had to come.
Yeah, you're right. I'm glad you did not choose the fusion, but why did you not choose the fusion? What were you worried about?
I was worried that I have 4 young children, and if I do a fusion, it would be worse, and then it would just keep continuing all the next discs. And I was really having like a claustrophobic feeling of I won't have any movement. I'll lose my mobility if I do a fusion.
And with the Deuk laser disc repair, you can see we went in with a 4mm incision. There was no bleeding. There was no hospitalization. She was asleep for an hour while we did her procedure, and you basically woke up pain-free.
Yes, I was actually very emotional when I woke up because I was like, our whole family needs to come here. All of our parents are in pain, so this is where you need to come.
We'll take good care of them here. Well, share with the audience watching what life is going to be like for you now and anything you want to tell the audience.
I feel like when you're in chronic pain for so long, you start to have anxiety, have maybe a little bit of depression, and all of that has completely lifted. And I think doctors will be like, oh, you're just depressed, take this medicine. But that's not what it is. It's the pain, the chronic pain. So I know that my quality of life will be much better now. My 2 boys play hockey, and there were so many times I couldn't sit in the stands. So it's really exciting.
Congratulations.
So, yeah.
All right. Well,
Thank
enjoy your
you.
life with your family.
Yes, thank
All right.
you.
Let's get